Proper healthcare is one of the essentials in our path of seeking survival, and the necessity of achieving adequate healthcare services is an urgent code that we must respond to. Nevertheless, in recent decades, the health crisis in Egypt has escalated in a big manner. Now, healthcare services have become major challenges, and the tools like technology must be introduced. The Egyptian society encounters dozens of challenges as time goes by. Atop that mountain of issues lies the healthcare sector with all of its channels. First of all, medical institutions in Egypt face many difficulties, from overcrowding in hospitals, the lack of capabilities, and the unreliability on technology in many institutions. Providing innovative and easy technological solutions will contribute to solving many of the current problems, and even achieving a great benefit from the available resources. For this, we sincerely present Se7ety.
Se7ety is meant to be an integrated platform which conducts and treats the current main vital issues within the Egyptian medical institutions, such as 1. Poor organization in clinics inside hospitals and overcrowding. As a result of peak times, this lack of regulation may lead to failures within the system, especially for emergencies. 2. The lack of access to the hospital's resources, including manpower, as such information is necessary before heading to the institution in order to decide whether it has what meets the patient's needs or not. 3. The inability of ambulances to cover all cases and relying on old methods to infer the location of the patient, which may lead to the loss of the patient's life. 4. The dependence on the old methods of reservations that require going to the reservation office, which leads to waiting, wasting time, and overcrowding. And 5. The absence of a medical record for the patients, which might result in that the doctors prescribe treatment that may not be appropriate for the patient's conditions and may lead to serious complications. And the solution? Please welcome Se7ety.
The application has two extensions, mobile app and website. The platform has an easy, smart user interface, provision of multilingual UI, and many programmatic features that make the program smooth for users. The application offers an innovative solution for the mentioned problems in a modern and easy way. The solution is based on a multi-staged infrastructure.
In the first stage, the application shall provide the option of picking a hospital, whether it is the closest to your location using the GPS or intentionally chosen. Indeed, you can choose the institution based on its assessments provided by the users. And when choosing the hospital, you can view its profile on the application, synchronize and check the capabilities and resources within the institution. In addition, the profile shall provide information of the available doctors at the time. The user can choose a specific doctor and book with the option of paying online or at the hospital. Indeed, real-time synchronized tracking of the queue and an estimate for the time of the appointment shall be viewed to the user.
The second stage, an ambulance service, will be provided with the push of a button. You just have to choose the reason for your request from the list in moments and determine your location automatically until the ambulance to ensure rapid access. The reason for the ambulance request is selected so that the ambulance priorities are determined. If the number of requests is greater than the number of ambulances, the priority is automatically evaluated to serve the most critical cases first, according to the data set by the Ministry of Health. The third stage, which shall be nearly revolutionary in the medical field in Egypt, as it aims to make a medical record for each patient participating in the application or in the platform applied at the hospital. Patients' examinations and results are recorded on the back-end database, including the description of the disease and the prescribed treatment. The platform stores all of this information so that it benefits including the doctors who were in charge of the patient in order to help any other doctor in examining and giving the right code. Here's an initial design for the app and how it works.